Good morning. First, I want to thank the members of the media who are with us today on this very special day, an exciting day here in DeKalb County, Georgia. I'd especially like to acknowledge and appreciate the outstanding work that Dr. Elizabeth Ford and her staff have done, are doing, and will continue to do on behalf of DeKalb County's residents. I can't tell you how impressed I am by this lady, by the men and women who stand with her every day, and the level of dedication and commitment they have shown on behalf of the residents of DeKalb County. Let's give her a round of applause. Thank you so much, Dr. Ford. Dr. Ford has been my North Star throughout the COVID-19 pandemic. We talk on an ongoing basis, early and late in the middle of the day, and she has provided me with the information, the education, and the input that we've needed to fashion a comprehensive countywide COVID-19 response plan. And she was a key player in helping us to develop our COVID-19 budget that's been recommended to our Board of Commissioners and adopted. We knew from the very beginning that we were facing a major health crisis in DeKalb County. We knew through her input that we needed the DeKalb Board of Health to be the point of the spear in addressing rising infections and unfortunately those who may have lost their lives as a result of this insidious disease. I'm proud that because of with Dr. Ford's input, with the support of our Board of Commissioners, the plan that we recommended as the highest priority had a $13+ million appropriation for the DeKalb Board of Health. I want the media to know, and this is important for our citizens to know, that we have a multi-departmental strategy. The DeKalb Board of Health, and this surprises some people, is actually a state agency. So what we did at the county level was invest much needed resources in our state Board of Health to ensure that our citizens are safe and protected. What we have here today is a celebration of really the keystone of our strategy, a fleet of 10 vehicles, 6 such as this and others that will be going around the community with education and providing much needed services. But none of this could have happened without the support, the unanimous support of our Board of Commissioners, and I'm delighted that Commissioner Larry Johnson, let's give Commissioner Larry Johnson a hand, is here with us. He's been a key player in all health-related issues, and I'm delighted that he was able to come and be with us today. Before I introduce Dr. Ford, who will provide more detail about these vehicles, I want to invite Commissioner Larry Johnson and ask him to provide us with a few words on behalf of the DeKalb Board of Commissioners. Commissioner Johnson.
Good morning, everybody.
Morning.
It's another great day for DeKalb County and for wellness, and thank you, Dr. Ford, for your vision, for your tenacity and your resilience. CEO Michael Thurmond, I brag about him all over the country because you want a leader in this time, somebody who's resilient, transformative, who really cares about the citizens. And man, I love this, is wellness on wheels. We can go now give you fresh fruits and vegetables, immunize you, physical, prenatal services, whatever we could do to make sure that the quality of life of the residents of DeKalb is whole. And that's what, if we haven't learned anything about this pandemic, we have learned that public health is now the cornerstone to all of our quality of life issues. And I talk about people all the time, they say prevention. We didn't know what prevention means, but now we understand that what this wellness van and what our CEO and Dr. Ford has been focusing on is about the stuff that you didn't see happen, the stuff that you may not even see on the news. And that's what prevention is all about. It's not that warm and fuzzy feeling. It's those families, it's those members of the families that did not get sick, the ones who found out from getting the test that they had COVID and now they're getting treated for it. And so I'm excited that DeKalb County is on the front line, is doing this work that we need to be done. And thank you, and let's continue to do more good work because the citizens of DeKalb is our first priority, and the wellness of the county is necessary and needed for us to be successful. Thank you, Mr. CEO and Dr. Ford.
Thank you so much, Commissioner. Thank you so much for your support. Commissioner Johnson said it best: multi-agency, multi-dimensional strategy, more than $13 million with the Board of Health, nearly $3 million with the Community Service Board to increase mental wellnesses, food distribution, nearly $2.5 million in providing food, nutritious fruits and vegetables and protein to families all across this county. But now, our Sojourner Truth and Harriet Tubman, our North Star in prevention and health and wellness in DeKalb County, our doctor who's always on duty, our doctor who never fails to speak truth to power, no matter where that power might reside, my friend, none other than the Honorable Dr. Elizabeth Sandy Booth.
Best baby doctor in the world. The best baby doctor in the world.
Do you think he likes me? Good morning, everyone. First, I must thank the most amazing, most creative, most extraordinary team of Board of Health staff who I can talk the talk, but they always make it happen. And so we would not be here celebrating this day without them. I have to thank the CEO and the Board of Commissioners, because it's one thing to dream a dream, but it's another thing to have people that can actually make your dreams happen. This particular unit is a culmination of literally about 6 years worth of wishes. The goal was to not only create a solution to the pandemic as it relates to testing and now vaccination, but to address the underlying issues that led to the health inequities that caused the differences in death rates on the people of color in this county. And so it wasn't enough just to have units that were doing testing and treatment, but let's look at why we saw the numbers that we saw. And so these vans, we have 4 small ones this size, and then we'll be getting 6 larger ones. These vans are going to address the health disparities that we see in this county. These vans will be put on the road to address the chronic diseases, the hypertension, the diabetes, and the food insecurity that we saw that contributed to the negative outcomes from COVID-19, but not just COVID-19, to cancer, to hypertension, to heart disease. So these are a long-term solution. It wasn't enough just to have something to address this issue, because this issue was a symptom of a larger systemic issue. And so these mobile units are going to be game changers for DeKalb County. This is the perfect combination of technology and compassion. And they will go throughout this county in the neighborhoods that need them the most and provide not only COVID testing, COVID vaccine, but also chronic care and referrals to our telemedicine program. So there may be doctors located here or throughout the county that will also be able to connect with folks on these units so that you don't have to come to the health center. You may not necessarily have to deal with a transportation issue. You might get to just come downstairs and get on a mobile van and get your examination and get your blood pressure checked and get your glucose tested and all that. So this is going to be a legacy that this community will get to enjoy long after all of us are not even standing here anymore. And I cannot express my joy, my delight, my pride in everyone who made this happen. Thank you to my amazing team, again, to the Board of Commissioners who again voted anonymously, no questions asked, and of course to my CEO, who is my Wizard of Oz, who makes everything happen. This is an amazing day in the midst of a lot of sorrow right now, and I hope that this is going to be a turnaround for us that will allow us to more efficiently deliver vaccines, as well as our just chronic care to the folks that need it the most in this county. Thank you so much. So I have Dr. Sedessa Spivey, who is the manager of our Health Assessment and Promotion Division of the Community Health and Prevention Services part of the DeKalb County Board of Health, and she will provide the tour of the mobile unit.
Any questions for Dr. Ford? Any questions? Tyler?
She talked a little bit more about how these may be used specifically as regards to testing and vaccination?
Okay, sure. So the question was, how are these vans be used for testing and vaccination? Well, they're mobile units, and so we know that the first tiers of priority for the vaccine are of course our healthcare workers, but also those who live in long-term care facilities. CVS has a responsibility of managing the larger facilities, but there are still facilities in the county that did not get on the list for CVS or Walgreens, and so the Board of Health will be using these mobile units to visit those institutions and provide vaccine not only to the residents but also to the staff. When will they arrive and what neighborhoods will we use first? So the one's coming this afternoon, another one is coming. We were hoping we'd get here before the conference, but it's on the road. And then the rest will arrive before December 31st. So we'll have the two additional small units, the two additional small units and the 6 large units will be here all before December 31st. The neighborhoods will be determined based on our GIS mapping of where our burden is. We know from COVID testing where our highest numbers of COVID disease are, and the assumption would be that that would be the same areas where we have overburden of chronic disease as well. Thanks.